These are lumbar extension exercises. These are the most common exercise to centralize pain, numbness, or tingling down the leg or when you are severely lacking extension. So let's talk about the traffic light rules first so that you know when to do the exercise and when to not do the exercise. So a green light means that your symptoms get better after you're done doing the exercise. So you have a 4 out of 10 pain and you do the exercise and afterwards your pain is only a 2 out of 10, that's a green light, keep going. Or if you had pain, numbness, tingling going down to your foot and after the exercise it's only going to your knee now, that's a green light, keep going. Yellow light means that symptoms get slightly better or slightly worse during the exercise, but after you're done, they're about the same as before you started. So if you had a 3 out of 6 pain before, during the exercise, maybe it goes up to a 6 out of 10, but afterwards, after about 5 to 10 minutes, it's back down to a 3 out of 10. That's a yellow light. Continue doing the exercise, but proceed with caution and pay very close attention to your symptoms. A red light means that symptoms get worse after you're done with the exercise. So, say you have a 3 out of 10 pain, you do the exercise, and 5 to 10 minutes later, your pain is worse. It's now a 6 out of 10, or the pain goes further down your leg. This is a red light. You need to stop doing that exercise. So, let's get into the exercise progression for lumbar extension. Extension in our low back means that we're going to be bending backwards. So this first exercise we typically use when someone is kind of stuck in a bent forward position like this, and it's as simple as just laying on your stomach. So that's what we're going to do. So you're simply going to lay on your stomach, and from here you might have a little bit of pain, discomfort in your low back, and it should get better as you sit here. That would be a green light. If it gets worse, that would be a red light. After a little bit, once the pain's decreased, we're going to prop you up on your elbows. And this is where most people will start. As you can see, my low back is getting a little bit more extension now, and then you're just going to sit in this position for a while as well. And the longer you sit here, the better the pain should get, the better any symptoms down your leg should get. The next progression to our lumbar extension exercise is a press up. So we're going to put our hands right where our elbows are, and we're going to do a push up with our upper body and try to keep our hips on the table. We only want to go as far as we can until we hit a little bit of pressure or discomfort and then go back down. So starting out, you might hit a little bit of discomfort right here, come to that point, and then come back down. And the more you do it, the more comfortable that position should get, and you should be able to go a little bit further. We want to go to the point where we can get our elbows completely locked out, like this. And if that's still not enough, we can add a little bit more pressure to the stretch by changing how we breathe. So we want to inhale on the way up, exhale once we have our elbows completely locked out, and let our hips sag to the table. So we're going to inhale, exhale, and let our hips sag. Come back down and do it again. Inhale, exhale, let the hips sag. For some people, doing extension from a standing position just works better for them. Or maybe when they're at work, they don't really have the opportunity to get on the ground and do the press-up exercises. So this is a good alternative for those people. So what you're going to do is you're going to take your fists, put them right over that area that's a little bit stiff, a little bit sore. You're going to push your hips forward and lean back as far as you can. Then come back, stand up nice and tall. Do the same thing. Push the hips forward, lean back as far as you can, and then stand up tall. Again, this is just a good alternative if you're not in a place where you can lay on the ground to do your press-ups. As you're doing these lumbar extension exercises, remember the traffic light system. Stick with the exercise that gives you a green light, meaning that it continually makes your symptoms better. And if you ever get a red light, stop doing the exercise immediately. Let me know the next time you're in the office so we can figure out what exercise is going to work best for you.